Let's be honest. Working in healthcare today feels like trying to change the tires on a moving car. We're dealing with a constant stream of technological advances, new regulatory hurdles, rising patient expectations, and relentless financial pressures. It's a lot. But in the middle of this storm, there is a constant, the central role of leadership. It is leaders who must guide our organizations through this turbulence. Our mission is to develop strategic plans that provide both direction and stability, while somehow fostering the adaptability we need to not just survive, but to thrive. So how do we do it? How do we manage strategic planning and lead meaningful change? It starts not with a plan, but with people, and specifically with us as leaders. To be effective, we must embody a few critical qualities. We need an inspiring vision, a clear, motivating picture of the future that pulls everyone forward. We must practice effective communication, ensuring transparency and clarity in every decision. Shah says, so we have to be trust-building, establishing credibility with our staff and stakeholders every single day. We need self-management, the ability to regulate our own emotions and behavior to handle the immense challenges ahead. And finally, we must practice empowerment, enabling our staff to take ownership and contribute to the change. With that leadership foundation, we can engage in a meaningful, strategic planning process. This isn't about writing a document that sits on a shelf. It's a structured approach to aligning our resources with our long-term goals. The process has 4 key phases. First, consultation. We must engage staff, patients, and partners from the start. Inclusiveness isn't just nice to have, it's essential for buy-in. Second, the planning phase. This is where we conduct an honest SWOT analysis, looking at our strengths, weaknesses, opportunities, and threats. We look inward and outward. Third, implementation. This is where plans meet reality. It's about allocating resources, scheduling activities, and sequencing steps effectively. And fourth, evaluation. We must use impartial reviews to assess our progress and identify where we can improve. This entire process is held together by key elements: clear goals, sharp prioritization, smart scheduling, and constant measurement, all to ensure we maintain stability even as we change. But strategic planning is just one part of the puzzle. To make it stick, we need organizational development, using behavioral science to strengthen the very health of our organization. This means being willing to change not just our strategy, but our systems, structure, culture, and management capacity. We can use interventions like total quality management for continuous improvement, or re-engineering to radically redesign processes for better efficiency. Now, change in healthcare isn't like change in other industries. It's guided by sacred principles, a focus on wellness over just illness, a strong service orientation, a deep recognition of diversity, and a refocusing on professional education. The change process itself moves through critical steps, from observing the situation and learning from data, to defining goals, developing strategies, and ensuring leadership continuity. And we must reward results to motivate our teams. But let's not forget the human element. How do people respond to change? We see a whole spectrum, from seeking truth and information, to denial, to passive or even active opposition, before finally moving toward investigation and hopefully acceptance. As leaders, our job is to guide them through this journey. Now, we can't talk about change in healthcare without addressing the elephant in the room, the need for managed healthcare. Our systems are under immense strain from rising costs, limited resources, and growing demands. Cost containment is no longer a choice. It's a necessity to keep healthcare affordable and accessible for everyone. What's driving these costs? A curative focus over prevention, population growth, an aging population, expensive new technologies, escalating insurance, and even fraud. The list is long. Managed care is the application of business principles to balance quality with financial responsibility. It's a radical departure from the old fee-for-service model. It uses tools like restricted provider networks, negotiated tariffs, and discounts on medications to control costs. The benefits are clear: more affordable access and a reduction in overall medical costs. But we must be clear-eyed about the pitfalls. When doctors are on fixed salaries, there's a risk they may rush consultations. Sometimes necessary tests or procedures can be denied due to cost restrictions. We have to manage the managers. This is where case management becomes so vital. It's a focused approach that coordinates patient care to save time, reduce costs, and, most importantly, guarantee quality. It's about providing the right care in the right setting at the right time. So, what's the takeaway from all this? The landscape of healthcare is evolving at a breathtaking pace, but we are not powerless. As leaders, we have the tools, strategic planning, organizational development, and a clear-eyed understanding of managed care. But our most powerful tool is our own character, our ability to communicate, to inspire trust, and to empower those around us. Let's not just be managers of change. Let's be architects of a better, more sustainable, and more compassionate healthcare system. I hope you enjoyed the video. Would appreciate it if you'd like the video and subscribe to the channel so we can reach more listeners like yourself. Until next time, stay informed, stay healthy, and continue exploring the world of healthcare with us. I remain your host, Sunday Clement. Thanks for listening.